Good morning, Mr. Smith. Come in, please.
Good morning, doctor.
Come in, please. How can I help you?
Doctor, I'm here for my ear. You know, I've had this. Ear, I came. Oh, sorry. Just 3 days ago, I started to have some aching in my left ear.
Oh,
Then I took some painkillers, paracetamol. It wasn't getting any better. But last night, the pain just went away, just all of a sudden.
okay,
This
okay.
morning, I woke up and I noticed that there is some pus on my pillow. So I gather it is from my
Uh-huh.
left ear. So I would
Uh-huh.
just could you have it checked, please?
Sorry to hear that. It must be painful. Can I ask some more question?
Of course,
More
yes,
some
sir.
question.
Some more questions. Yes, go ahead, please.
Uh, yes. Does your pain come and go or continuously
Uh, it,
before
yeah,
observing the pussy on your pillow?
yeah, it was there. Yeah, it was constant. It was,
Constant.
yeah,
And how bad is it?
it was, yeah,
From
it was,
0 to 10.
it was quite bad. Yeah, I would say probably 6 to 7 out of 10. But yeah,
Okay.
suddenly it disappeared last night, just like that.
Okay. And except of any painkiller, does anything make your pain worse or better?
Yeah, I took some paracetamol and I just took the edge away. But
Oh, yeah.
yes,
Only painkiller is better. Yeah,
that's
I
right.
know that.
That's right.
And do you have any other symptoms which is such like nausea, headaches, or something like that?
Well, not really. I felt a bit warm, but it wasn't any. I didn't feel sick or wasn't sick. Just yeah, maybe a little bit of headache.
Headache. Okay. So you said that you have had left ear pain for 3 days. Is it right?
Yes, that's correct. Yes.
And recurrently, you observed a pus discharge from your ear on your pillow. Yes, it's
That's
okay.
right. Yeah, this morning.
And after observing this discharge, you feel that your pain reduced. Yes, is it
That's
all
right. Yes.
right?
Yes. Yes.
Okay, and now you come to see me for knowing about your condition, your pain, and the treatment, and you also worry about deafness. Is it all right?
Yes, definitely. That's right. Yes.
Okay, I would say that you have something. You have something called otitis media. It means infection in your ear. It caused by a kind of bacteria lead to inflammation in the air canal, and after that infected and bulging your eardrum. And sometimes this infection and inflammation lead to small perforation on it. Is it okay?
Right. Okay.
And there is nothing about there is nothing to worry about. Is it will go away itself. It's self-limited, and it's need you follow your treatment plan, and after that you will get much better soon. Is it okay?
Yeah. Okay.
And now is better we discuss about your treatment plan. And are you ready?
Okay. Sure.
Okay. Your treatment plan, now I'm trying to explain your treatment plan in detail. Is it okay?
Okay.
Firstly, you have to take a course of broad spectrum antibiotic to disappear your infection in canal. It's necessary and important in the first stage of treatment.
Okay.
Is it okay?
Yep. Okay.
And after that, after finishing the antibiotic courses, we will visit. I will visit you again and assess your eardrum perforation. And after that, if the perforation is not treatment and or maybe hearing loss continues, the next stage need to give an appointment from audiologist for further assessment and evaluation, or sometimes maybe need the management of hearing loss. Is it okay?
Yes, sure.
And you can. Do you think you can do it?
Yes, doctor. But what about scuba diving? Because I normally do scuba diving. Is that possible?
No. What I suggest that is that you should better to avoid any activities with pressure changes during
Right.
this time, including the diving. I know that is the favorite hobby for you, but it's better in this time you avoided to do it.
So how
Is
long
it
should I do that, doctor? Is that serious? Am I going to go deaf?
No, no, no. I completely understand your concern and your worry, but I'm assured that there is nothing to worry about this. And if you follow your treatment plan, you will get much better as soon as possible. And there is nothing to worry about this. Is it
Uh,
okay?
okay. That's okay, doctor. Thank you.
Thank you. Is there anything I can help you today?
No, that's it, doctor.
It's okay. Okay, bye.
Bye. Okay. Right. So it's nearly 7 minutes. Um, right. Okay. How did that feel?
I'm so excited and so satisfied when I compared it with the last or maybe the last weeks. But I think that I need to more exercise and more working and focusing on it. It will be uh, make it better, get better.
Um, yes, definitely. So, do you feel? Are you satisfied? Do you feel it was 100%? Or I mean, how much do you score out of 10? Uh,
Really, in the about the structure and follow your guidance, I think that 9 or 10 out of 10. But I need in the express or maybe the pronunciation or completing and saying perfect sentence. I think that maybe 6 out of 10. But your assessment is important.
okay. Tell me, what was done well? What did you do well? The rapport was okay, yeah?
Yes.
And your
Information gathering, I think that is okay.
okay,
I try to summarize and only 2 or 3 maximum questions,
okay.
not long time.
Summarize, okay,
Summarize, I try to follow your order chunk, uh,
okay.
and
Uh, right. What else?
And after that, I need to reassure the patients about and explain about the different stage of treatment, and the end of is advice. And honestly, I know that how to start each of them, but I don't know if I did it perfect or not.
Okay. How about the patient's agenda, the ideas, concerns, expectations? Did
Yeah,
you?
I try to find it, the eyes of patients, and to explain, to reward the eyes to the patients in the Chang conclusion. Chang in summarize. When I try to summarize the giving collecting information from the patients, the end of this, I try to ask from the patient, you came to see me about your concern about the deafness and the process of treatment, and the patient said that yes. I try to check it with the patients,
Okay.
and when but I accepted the end of a conversation, the patient tried to show reluctant to avoid any diving or etc. And I try to focus on ethical issues, and I said that I completely understand why you want this, because this this gaming is your hobby, but there is no benefit for you, it's harmful, or etc.
Okay. Good. Uh, is there anything you could do differently?
Completely. Explore the eyes of the patient, and after that, when the patient's reluctant or follow your any your advice or your suggestion, now I know structurally how to approach to him with the ethical. I
Good.
completely understand there is no benefit. Yes, it is so helpful and is
Good.
a perfect guide for me.
Okay. Good. I think you could do better structure a little bit with exploring ice before, and so you didn't actually ask me about deafness and hearing in information gathering, but you mentioned it, and that's because you have prepared this before, but you didn't ask me, um, and
Yes.
I think you a little bit overdid the summarizing. Okay, in info gathering. Uh, so, um,
Overdid, you mean that is took a long time?
yeah, you did too much of that. You said sentence by sentence, you repeated and you checked every time. Well, it's not natural to do that, okay?
Okay.
So we do chunking and checking in information giving, not in information gathering, okay?
Oh, yes.
So basically, what we do, I mean, summarizing is like this. You say, okay, so let me see if I can remember, or let me see if I can remember everything. So you had an earache for 3 days, then it was quite bad, not responding to paracetamol. And last night, suddenly the pain went away, and you woke up in the morning and you noticed some pus on your pillow, and you've lost your hearing in the left ear. Is that right? Yes, that's right. So do you actually summarize all the findings all in one go? You don't chunk it here. So chunking
Okay.
and checking is for information giving, not for information gathering. Okay.
Yes, I know. Yes.
Um, Okay. I put an asterisk in front of the summarize because you're not supposed to do that in information gathering. Yeah, if you think it's too long, you can chunk it, but not in each sentence, and you're not supposed to check each time. So
Yeah.
when you break it, you don't check. You say, "Is that okay?" You just carry on, or just pause, and the patient can say, "Yes, that's true," or "No." They can correct you. They can tell you something different. Okay, or they can
Yeah.
confirm it, or um, right. So you don't have to check the understanding, and
Okay.
then. So you reassure, when you're reassuring, you said there's nothing to worry about, and then you said something,
If
uh,
you follow.
if you follow my advice or if you follow the treatment plan. Well, we don't usually say that. We say, well, um, well, obviously, that is something obvious. If you follow the plan, you will get better. But the best way to say that is, um, it is more likely or it is unlikely. So we use, rather than speaking in absolute words and to say definitely, or you will definitely get better. No, we don't say that. We say um, it's very unlikely to be permanent, or it's most likely temporary hearing loss, for example. Okay, so we tend to be a bit more conservative, to say something as an absolute fact. Okay.
Okay. For example, one sentences, for example.
Yes, so we can say, well, uh, so we can say it, with proper treatment, it usually, or it's almost always, uh, you said it's self-limiting. It is not. It was actually you're prescribing antibiotics. So it's not self-limiting. So you say with proper treatment or with effective treatment, it will most likely clear within a month. Okay.
Okay.
Or and I can see you in a couple of weeks for a follow-up, and I can arrange a follow-up for you in 2 weeks' time, and to have a look at your ear again. Okay.
Okay.
So we say it's most likely, it will most likely clear in a month's time, or most of the time, or usually. Okay, so you can say such infections, or these infections uh, most of the time respond very well to antibiotics. Okay.
Okay.
So basically, we don't say don't worry about anything. Nothing to worry about. No, we don't say that. We say, well, uh, you're responsible. If you say, well, don't worry about it at all. There's nothing to worry about. Yes, there is. So,
Okay.
um, okay. And you
Uh,
said yes.
Sorry, we never use this sentence for reassurance the patient. There is nothing to worry about that. I try to delete in my mind this sentence.
Yeah, we don't normally say that. Don't not. There's nothing to worry about. Uh,
Yes.
no, we don't say it. We say, well, it's very unlikely. You need to get used to the more objective language, and basically, well, as I said, that is judgmental. You say nothing to worry about. This is your opinion. This is not a fact.
Okay.
Okay. But the fact is that most of the time these infections clear within a month with proper antibiotics. So you shouldn't actually make assumptions about your opinion. If you say there's nothing to worry about, it's just an opinion, it's not fact.
Okay.
Okay. Uh, right. Um, okay. So basically, yeah, I think it was very good, and you were more fluent. I wouldn't give you 9 out of 10. I would probably give you 7. But yeah, it was better structured. You just overdid the summarizing in information gathering. Um, you did well in information giving. You can be more structured in information giving. You can say, first of all, what the cause is, that is the etiology, okay? So you can explain. You say, well, the diagnosis is infection in your middle ear, and don't use otitis media, okay? Because
Okay.
that's a medical term. Um, have you ever heard anybody, I mean, lay people say otitis media?
Okay. Yes.
No, no, it's only
10%.
doctors, okay?
Yes.
So people usually say it's an ear infection, and you can say it's a middle ear infection. So first of all, what it is, what causes it, what treatment, and then what is the prognosis. Okay. So these are usually the things that the patient wants to know. So first of all, what is it? It's a middle ear infection. Okay, is that serious? Not usually, and most of the time they heal very well. And how does this happen? It's a small hole. It's because of the fluid in your middle ear, and it becomes infected, creates a small hole, and it usually clears within a month without any complications. Okay. And what can I do about it? Well, you have to you need to take some antibiotics, and then you need to come back and see me, and then you need to avoid any pressure change, and including the scuba diving. Okay, what is the prognosis? Well, most of the time it clears with no complications, and almost always it gets better. Doesn't cause any hearing loss. But I can see you in 2 weeks' time and check it again. And if you have any reduced hearing, we can always send you for a hearing test. Okay. You said audiologist. Well, again, we don't say audiologist. We say hearing test. We send you for a hearing test.
Okay.
So deafness. Say that. Deafness. Deaf.
Deaf.
Deafness. Okay. Deafness. It's not deafness. It's deafness.
Yes.
Well, for antibiotics, well, we don't say broad spectrum to people. We just say antibiotics. Okay. Broad spectrum is again a medical term, so we just say antibiotics. Discuss about you. So you said that a couple of times. You discuss something. You don't discuss about something. Okay. Discuss means talk about. Okay.
Yeah.
Because in Farsi you use discuss with about, so that's why it's you make a mistake. Discuss means talk about. Okay.
Okay.
So
Don't need to say again about.
yes. So it is wrong to use about. So you just discuss something. Okay.
Yes.
Uh,
And
yeah.
another questions. The patient asked about the diving, and I try to focus on ethical issue. I said that I completely understand why you want this, because this kind of sport is your hobby, but there is no benefit, and in fact a risk of harm, like, and in terms of for example 2 or 3 complication, I said that. And again patients try to insist and don't follow your advice. For the second time, it's better I use your sentence, that you've got a problem and I'm here to help you do what the best is. Okay.
Yes, that's absolutely fine. Yes,
Yes.
exactly. So you just actually you remind your role that you're here to advise, and you're here to make sure the patient is safe. So, but it's their choice if they want to do something which is not, which is harmful. That is their own responsibility.
ببخشید من حالا این تیکش به زبان چون خیلی برام مهم بود، چون یه بار که مریض مخالفت میکنه، خب من با اتیک باهاش حرف میزنم. اگه دوباره خواست مخالفت کنه، من همون جمله که شما فرمودی، یعنی همون، من اینجا تو یه مشکلی داری و من اینجا هستم که کمکت بکنم، حالا اگر تو میخوای قبول نکنی دیگه این حالت این تیکر بهش نمیگم که مشکل. پس این درسته این اپروچ.
Yes, it is very important that how you say it, okay? So you shouldn't come across aggressive. So you need to be very empathic, and you say, okay, listen, so very slowly, okay? Not shouting, not loudly, very slowly. You say, listen, the reason I'm here is to make sure you're safe and you do what is best for you and not to harm you. Okay? And it is strongly advised, or it is um, um, uh, it is very likely to harm you. So it is strongly advised not to do anything which changes the pressure. Okay. So basically, we explain that's the explanation. I understand what you're saying, but listen, I'm here to make sure you're safe and you're not at any risk. But this is up to you to decide. But it is highly recommended not to change any pressure when you have ear infections. Okay. You said it's not to your benefit. Well, here
It is
scuba
no
dive.
benefit.
No,
Yeah.
no, no. It's not relevant to scuba diving. It's just harmful. Okay.
Oh,
Uh,
okay.
yeah, you cannot say that this is not for your benefit. It just
I know.
the patient wants to do something, and you just say, well, it's just harmful. It can harm
Okay.
you. Okay.
Yes, 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 I understand.
Right.